Okay, and then the other disability issue is poorly healed fractures. So the complication with poorly healed fractures is that risk of repeated injury is high. Rabbits, if they have a fracture that healed abnormally, they may have a foot that's kind of twisted out to the side. They could potentially have maybe less feeling to that foot, or if there was some sort of nerve damage that occurred with a fracture. So they may not be able to sense it as much, and they could potentially get it stuck in something again down the road and lead to refracturing. Muscle atrophy, again, because of the fact that we're not maybe able to move those muscles around that fracture site as well as they once were before. And arthritis does happen commonly with these guys as well. So ways to avoid issues, going to be that soft bedding again, making sure there's nothing they can get their toes stuck in to hurt themselves, and of course doing some physical therapy for muscle atrophy. I put the picture of that rabbit up there. If you notice, she's actually on a wire cage bottom. Just as an example to show you guys of what is inappropriate to have a rabbit with a disability on. This rabbit, I don't think she has a fracture of a limb. She's holding this limb out, but if you look at the way she's sitting, it's more like she has a back problem, and she very well could have a back fracture. If this rabbit does have a back fracture, this is one of the worst possible things that she could be sitting on, because if she has a back fracture, she may not be able to feel those hind limbs as well, and she could very well get a toe stuck into that wire bottom and injure herself even further. So not a good sort of substrate for that particular individual to be on. Even a rabbit that's totally healthy, normal, it's not recommended to have them on wire bottoms. Again, just because of the fact that they can get their little toes stuck in between the wires and hurt themselves.